Hi, my name is Jim Rocco. I'm a head and neck surgeon at the James Cancer Hospital in Ohio State University, and I'm also chairman of the Department of Otolaryngology, Head and Neck Surgery. So laryngeal cancer is a cancer of the voice box. It goes by laryngeal cancer, but many call it the voice box because it's easier to understand. So symptoms of laryngeal cancer often mimic common symptoms, but it could be a change in voice, both in how loud you can speak or a change in your quality of your voice. It can sound raspy. Sometimes you can cough and see a little bit of blood. And you can also have pain in the mid portion of your neck. Sometimes when you eat, you can feel pain when you swallow. And sometimes you can actually, when you're eating, cough because food is going down the wrong way. Treatment of laryngeal cancer is actually quite complicated because there's many different types of treatment. Key to all these treatments is what's going to happen to the voice. So one way to treat laryngeal cancer is what we call organ preservation. And in organ preservation, what we're really doing is preserving the voice quality. So for when you're evaluated with laryngeal cancer at the James, one of the earliest decisions that we make is this a cancer that we can treat, your laryngeal cancer, where we can preserve your voice function? So strategies to preserve your voice function can include local little surgery with like a laser, in which it's very minor, often a day procedure. It can also be radiation therapy or radiation therapy with chemotherapy. All of these are designed to preserve your voice function. One of the most important things is early in the analysis of your cancers to see whether you're eligible for those types of treatments. In people who are not eligible for organ preservation, meaning preserving the voice box, then usually it's surgical therapy. And surgical therapy of laryngeal cancer is called a laryngectomy. A laryngectomy entails a surgery that would involve opening up the anterior portion of your neck and kind of going down to the voice box, sparing all the vital structures and removing the voice box. Every patient who comes to James who's being treated for laryngeal cancer will be seen initially by a head and neck surgeon. At that time, they'll also be seen by a special team of speech and language pathologists that'll help guide you in terms of picking therapy to preserve your voice, as well as how to manage swallowing and eating around the time of your therapy. In addition, every patient is presented at a multidisciplinary clinic, and that's a clinic where we have pathologists, speech language pathologists, surgeons, radiation oncologists, and medical oncologists, all who specialize in the treatment of laryngeal cancer. And that's where the discussions are made about what type of therapy you should undergo. So during those evaluations, you'll be seen by medical and radiation oncologists as well as your surgical oncologist when indicated. In addition, many people don't understand, but during radiation therapy, your teeth are at risk. It has to do with the effect of radiation on your saliva. And again, at the James, you will get a dental evaluation as part of your initial assessment to help prepare you for your therapy. One thing that most patients should understand is we offer a lot of clinical trials for head and neck cancer. Being an NCI-designated cancer center, ECOG trials, RTOG trials, and NRG trials are all open at our institution. The James is actually one of the top recruiters to trials in the nation, and in fact, in head and neck cancer, we're one of the leaders. So often when patients don't have other options and they need to get access to trials, that's part of what happens during your evaluation. In addition, we have a tremendous amount of resources that you normally can only find at a cancer center. For example, we have a head and neck social worker to help you with things like family medical leave or keeping your electricity on when you can't work, when you're getting therapy. These things are part of a cancer center, and they're very, very important and are difficult to find in other places.